Here we'll talk about Hirschsprung disease. I don't know if it's pronounced that way, but coming to the etiology, it is a congenital anomaly. That means it's seen in the newborn babies, and also there will be increased risk if it is associated with Down syndrome, and mutations in RET gene can also be seen. So, what is the pathology? So, these neural crest cells fail to migrate, because of which there is no formation of ganglion cells. Because why? The ganglion cells are derived from the neural crest cells. If there is failure of migration of these cells, there will be no derivation of these ganglion cells. Absence of ganglion cells in the submucosa. What is the function of ganglion cells? They form the nerve plexus, like orbital plexus or Meissner's plexus in the intestine. So this plexus helps in peristalsis. So on total, what is happening here? Failure of migration of neural crest cells leading to absence of ganglion cells, no formation of nerve plexus, no peristalsis, leading to the obstruction in the intestine. So what will be the clinical features? There will be bilious emesis. That means the bile contents get vomited out. Vomitus will be usually green to yellowish color. Why is this happening? Because there is an obstruction at the level of intestine. The baby is unable to pass stools through the anal canal. They will, so this bile contents get refluxed into the stomach, and through the mouth the vomitus will be passed out. And also there will be abdominal distension. See, in the intestine there is obstruction. So the above part gets dilated. The bowel walls get dilated, because of which the abdomen looks distended. And failure to pass the meconium in the 48 hours after the birth. Baby is unable to pass the first stool even after 2 days after the birth. And chronic constipation can be seen in the clinical features. Coming to the diagnosis, on digital examination of rectum, you can see empty rectum. Why? Because obstruction is at the level of intestine. The baby will not pass stool into the rectum. That's why there will be no stool in the rectal wall. Right? On barium imaging, you can see the specific cone-shaped transition zone. This transition zone can be seen on the X-ray. In this right picture, you can see this red color arrow, right? So this narrowed part of the intestine is abnormal. The above dilated part of this bowel is normal. So let us see what is happening. In the normal part, there is presence of ganglion cells, there is presence of nerve plexus, so there will be peristalsis happening. Now it is normal. So at the level of this narrowed part, the abnormality starts. That means absence of ganglion cells, leading to no formation of nerve plexus. That means absence of peristalsis. So when there is no peristalsis, the stool won't pass down. It gets accumulated above. So the above part, which is dilated, is a normal part. The below part, which is narrowed down, is the abnormal part. Normal portion with ganglion cells is dilated. The abnormal portion with the absence of ganglion cells is narrowed. Suction biopsy is done. Why? We need to take the cells from the submucosal layer. That's why the suction is applied. We'll see if ganglion cells are present or absent in the submucosal layer. So absence of ganglion cells indicates this disease. Coming to the treatment, resection of the part of the intestine which is deprived of ganglion cells, right? See, for example, in this picture, this narrowed part is deprived of ganglion cells. We'll dissect it. That is the treatment.